Welcome to Hudson Health. My name is Dr. E.J. Akanyili. I am Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. Today we're going to talk about a group of diseases you may not have heard about, do not often make the headlines, but probably should. We are going to talk about hepatobiliary diseases. So what is hepatobiliary diseases? They are diseases of the gallbladder, the bile duct, and the liver. These quiet yet almost unnoticed organs are somehow the powerhouses of our body and provide a lot of help with detoxification, with processing our nutrients, with energy, especially the liver. And when things go wrong, they affect multiple parts of our body and the ability to be well. I'm really excited to talk about this with our guests today. We're going to bring a lot of information to you and discuss the latest advances, not just with technology, but also in treatment of liver diseases, cancers, and also we want to talk about lifestyle and modification. Did you know that fatty liver, which is linked with diabetes and obesity, is now the leading cause of death for liver disease in the United States? So very excited to have a wonderful guest here today. It's going to be Dr. Andrew Della Torre. Please stay tuned.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights. Your one-stop store for residential and commercial floor treatments. Carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Hello, welcome back to Hudson Health. My name is Dr. E.J. Akanyili. I'm Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. Today I am beyond thrilled to discuss all things hepatobiliary disease with you. It is simple. The hepatobiliary system includes the liver, the bile ducts, the gallbladder, the pancreas, and most people may not have paid attention or heard of any of these organs, may not make the headlines like heart disease, for example. But I'm here to tell you, along with our incredible guest, how important these organs are. Maybe a little bit of a nerd, but bear with me. The liver, for example, is my favorite organ. This quiet yet quintessential organ becomes a detoxification center. It stores energy. It's really integral to our metabolism. It helps us with fighting diseases even. So when we have liver disease or liver pathology like cancer, hepatitis, it tends to affect all of our well-being. As I mentioned in our introduction, even things that may seem benign like fatty liver that is linked with diabetes and obesity is really very prevalent in the United States, and many people do not even know that they have them. But there is hope. There are modern advances in blood tests and imaging that are able to detect disease early. People are able to take care of themselves with minimally invasive advances, even in liver cancer therapies and surgeries. The key is to know and to be aware and to get treatment. And speaking of that, my guest today, Dr. Andrew De La Torre, is a world-renowned surgeon who specializes specifically in the hepatobiliary system. We're excited to have Dr. De La Torre talk about treatment options, detection of disease, lifestyle, and how we can hone into all the opportunities we have here in Hudson County without having to travel. Liver disease remains a killer of people in the United States, and we want to make sure you have all the answers and the resources, especially for people who have a diagnosis on how to navigate the world of therapy here. We're very excited. I look very forward to meeting Dr. De La Torre and introducing you to him and asking him a lot of questions. Stay tuned.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its two newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hello, and welcome back to Hudson Health. My name is Dr. E.J. Akanyili. I am Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. Today, I have the unique honor to welcome Dr. Andrew De La Torre. Dr. De La Torre is not only a liver, bile duct, and pancreas surgeon, but also in the military reserves. Thank you for your service. Welcome back.
Thank you, Dr. Akanyili.
We're very excited to talk to you today. In the introduction part, I talked about how there's a prevalence of hepatobiliary disease in the United States and how people may be affected and not even know it. But our viewers want to hear from you. Tell me about what's the prevalence of these diseases? How does it affect the body? How does it affect people, different ages?
Well, hepatobiliary disease is and thank you for having me on the show, first of all. I'm very honored. Hepatobiliary disease, or hepatopancreatobiliary disease, is really broken down into three categories. You have liver, and you have pancreas, and then you have bile duct. So liver is its own unique little entity, and then you have a pancreaticobiliary disease. I focus on all three, but I think when you discuss those three diseases, they have to be differentiated. So liver disease, is going to be basically Hep C, B. Now we have what we call metabolic associated liver disease, which is very prevalent in our society. And as those diseases, and we can't also forget alcoholic liver disease, which is also unfortunately very prevalent in our society. At the end of the day, liver disease is what we're trying to prevent is cirrhosis. All these diseases, untreated Hep B, C, alcohol-related liver disease, and then metabolic liver disease. If we don't find these diseases early and make efforts to slow down or stop progression, at the end of the day, patients progress to cirrhosis.
So cirrhosis is sort of the common pathway. So you have liver disease, whether it's metabolic, we'll get back to lifestyle, alcoholic, hepatitis A, hepatitis B. So tell us about cirrhosis.
Right.
Like, what does that mean?
Cirrhosis just means your liver has extensive amount of scar. And then as the liver becomes damaged, the beauty of the liver it can repair itself.
It's such a beautiful organ.
I love the liver.
I do too.
Yeah, it's I mean, I've been doing liver disease. I was a liver transplant surgeon for 12 years at the medical school in Newark. Since then, I've been doing what we call population health and liver disease. And the goal is to find people with cirrhosis before they develop complications of cirrhosis. So you have cirrhosis with extensive scar tissue throughout the liver. And as that progresses, the liver will lose its ability to repair itself. Mm-hmm. It's a balance between normal liver and scarred liver. But as the progression of inflammation, and basically what happens is you have hepatitis. Hepatitis just means inflammation of the liver. You can have viral-related hepatitis. You can have toxin-related hepatitis like alcohol. And then you can have overabundance of fat, which when you have the overabundance of fat, that can cause a hepatitis and the inflammation. So the inflammation, progressive inflammation causes scar tissue. Progressive scar tissues over time will cause cirrhosis. Once a person has cirrhosis, you can go several different ways. You can have complications of the scar tissue, an entity, what we call portal hypertension, where the blood cannot flow through the liver because of the extensive amount of scar tissue, and then you can obtain or develop complications from that. Then you can go into basically liver failure, which means your liver just loses its ability to detoxify, to make proteins, and then you turn jaundiced, and then you can have a complication from that. And then what I focus on is liver cancer. Liver cancer is a preventable disease. Once you know a patient has cirrhosis, that patient should be screened every 6 months with an ultrasound for liver cancer. And it's unfortunately because the medical community does not really do a great job of identifying people with cirrhosis, because it's really a silent killer. I mean, your liver, because it can regenerate, you can have extensive cirrhosis, and you don't what we call decompensate. Things don't just fall apart until the very end. So people can have a complication from cirrhosis, or what we call portal hypertension. They can develop dilatations of the veins in their esophagus, and then end up in the emergency department bleeding, vomiting up blood.
So one of the things we try to do in this show is sort of to break this down for people,
right? Especially
people at home who may not, have seen a primary care doctor, really have any interaction with the healthcare system. Yeah. I think, when people hear cirrhosis or hepatitis,
right,
they think it's an esoteric illness that happens to people perhaps in the developing world. But tell us more about sort of the scourge of fatty liver and how hepatitis and all this pathways to cirrhosis can be hidden, and people may not know without getting screened that they're already progressing on the path to this disease.
Well, first of all, liver disease, like death, when we look at the Center for Disease Control, mm-hmm. Liver-related death is the 5th leading cause of death amongst people age 45 to 54. So it's not really esoteric. In fact, it's actually more common than people believe. And unfortunately, as a result of metabolic liver disease and alcoholic liver disease, it is we predict over the next 10 years, it will go up and up and up. So right now it's number 5. A couple of years ago it was number 4, but it's basically the top 5 leading cause of death of people between the ages of 45 and 54. So it's not really as esoteric as people believe. Mm-hmm. That being said, most people with cirrhosis don't know they have cirrhosis until they have a complication of cirrhosis. And that can be a bleed from bleeding veins in your esophagus. You can develop ankle swelling. You can develop accumulation of fluid in your abdomen or your belly. And these are complications of what we call portal hypertension. And those patients typically, they go to your emergency department, and for the first time, that's when the diagnosis is made. And unfortunately, that's how we find a lot of people, because it is very hard to make that diagnosis. And that being said, what I spend a lot of time is educating primary care doctors about who's at risk, and what are some things that we can do to help us find those people earlier. Because, for example, the thing that we are fighting very hard is if you took 100 people with liver cancer, right? Probably only 25% are curable. And it's not that they're not curable, it's because we do such a poor job of finding early liver disease. So by the time they get to they are seeing a healthcare provider, they're really already having stage 3 and 4 liver cancer, which is not necessarily, is unlikely to be curable.
So when we come back, I do want us to talk about diagnosis because
Right.
we want people to be able to catch this disease
Right.
before it progresses to liver cancer, which, as you mentioned, is not very treatable.
Right. So the thing is, so what we spend time on is who are those high-risk populations?
We'll hold that thought.
Yeah.
We'll be right back.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back. I'm so excited to welcome back Dr. Andrew De La Torre. Welcome back. We had just this great session the last time where we talked about liver disease. Now let's talk about diagnosis.
Right.
And that's the hardest part,
Oh.
right? There's so much pathology that gets missed. So what are the advances in diagnosis? How do you risk stratify people and find those high risk populations and gets them into treatment before they advance?
Well, Hudson County, if you're a liver specialist, Hudson County is the place to be because we have such a diverse population. And I think when you look at the 4 entities that you're going to have basically 90% of liver disease is preventable. And the question is, how do you find it early? So hepatitis. So viral hepatitis. We have hepatitis C and hepatitis B. A lot of that, unfortunately, like hepatitis C is related historically to IV drug use. In our older population, prior blood transfusion, or there are certain countries in the world where it's just very common, like Egypt, Pakistan, some of parts of Eastern Europe, where it's just 10% of the population we know they are been exposed. And hepatitis B is very similar. The Asian population, Filipino population, those Vietnamese, Far East Asia, South Asia, high rates, 10% of the populations have what they call chronic infection. So those populations are here. So a lot of it is just knowledge about, if you come from Vietnam, if you've never been tested for hepatitis B, you need a one-time test. Or if you came from Egypt, you need to get hep C screening or testing. So that's one portion. Second portion is alcohol use. Alcohol use, anybody who's using alcohol, we should make sure they don't have concurrent viral hepatitis. Or one of the things we look at in the liver world is your platelet count. If you see a patient with a relatively low platelet count, in my mind, you have cirrhosis until proven otherwise, and I'm looking for a reason why your platelet count is low.
And that's they can find out when they get routine blood work,
right?
Or their primary care visit.
They just may pop up into the ED for something unrelated, and if they have a platelet count, let's say 145, 150, 160, in my mind, that's a big red flag. So that's actually, and if you look at platelet count, that's a very strong predictor of liver damage or liver scarring. So that's the other thing. And then for the metabolic liver disease, we have the triad: diabetes, hypertension, and cholesterol lipid issues.
And obesity.
And obesity. So you have those people. It's a separate population of people. And again, it gets down to what's your platelet count. We use something called a FIB-4 score. Then it's more for your medical providers, how those medical providers can do a initial screen or for liver disease. But, again, like in a lot of patients, particularly with the metabolic liver disease, you're looking at some of their lab values that will help you risk stratify them for liver damage. And because if we can't find the cirrhotics, then we're never going to make any progress in terms of reducing death from liver disease. So the big ticket item for me is how do we reduce death? If I can reduce your risk for death from what we call decompensation or just everything just falling apart or being diagnosed with advanced liver cancer, we're kind of like, we got to focus on that.
So let's go back. So we've worked on how you not do the diagnosis once you actually have cirrhosis or risk of it. If we went back a little bit, how do people prevent? You mentioned so much of the liver disease is preventable.
Right.
Metabolic liver disease, alcoholic liver disease. Can you talk a little bit about lifestyle, exercise, anything that could help get people, and of course, prevent screening by where you were born or where you visited as a tourist?
I'm just talking about the broad category.
Sure.
So alcohol is very easy. You reduce your alcohol consumption, and that's hard because I think one of the things we struggle with in the liver world is we see a lot of people with alcohol dependence, what we call alcohol overuse, and to get them into behavioral counseling is sometimes a challenge. It does help, and good programs exist where we can help people reduce their alcohol use, and that's pretty easy. I mean, stop using alcohol, you will do well. The metabolic liver disease, that's a challenge. Unfortunately, in our society, we eat too much, we don't exercise enough. We send people to dietitians all the time to try to figure out what not to eat. Lifestyle change is huge. So my average day when I have an office full of people with metabolic liver disease is take the stairs. It's just simple little things that you can do, that may help you. Activity is important. Don't eat late at night, try to eat earlier in the day because your liver is just basically doing what your liver sees. If your liver sees high blood levels of sugar in your blood, it's going to store it into fat. And that's just what the liver does. So we have to kind of take a very basic approach. People just, unfortunately, just eat too much. And these are lifestyle changes that we need to work with our patients, helping them to change a little bit of their lifestyle, a little less food, a little more exercise. But you don't have to go to the gym. In fact, there was a very good study 20 years ago, just by something as simple as avoiding escalators and elevators, people can actually improve their liver function or reduce the amount of fat in their liver.
Getting exercise in your everyday
Right, you just
life.
have to figure out how do you incorporate it into your daily activities. I mean, you don't have to have a very expensive gym membership, but one of the things that we do less is we just don't walk as much because we just jump in our cars and we go here to there, and we won't even walk 3 blocks down to the supermarket to buy something. We got to jump in our car. That makes a difference. Processed foods, we have a big challenge in terms of how we have to try to help people change their lifestyles that will help them avoid what we call metabolic associated liver disease. It's a very treatable disease, but it's just got so many multifactorial.
So let's pivot, Dr. Della Torre, and that's so helpful. And we've talked about it multiple times on this show. That's a passion of mine. But let's talk, you're a surgeon. Let's talk a little bit more about the advances in surgery for liver disease.
Well, I mean, again, the advances of surgery in liver disease, I mean, it depends what you want. Are we talking about bariatric surgery to help people lose weight and change their diet? Or are we talking about liver surgery for cancer?
Surgery for cancer.
Well, I mean, liver surgery for cancer, it's routinely performed now laparoscopically. That's a big part of my practice is, major surgery, laparoscopic, small incision, less lung complications after surgery. You go home earlier and you have less pain. So that's, there are many programs doing that. I think that's where liver surgery is going, is what we call minimal access surgery. It's not minimally invasive because it's still a pretty invasive surgery. You just walk away with a small scar, but there's a lot of work under the hood. And it still has significant risk. But this, as we make progress surgically, this is where things are going. And that's great. I mean, that's part of being a surgeon.
Thank you for joining us today on Hudson Health. Dr. Andrew De La Torre, thank you for joining.
Thank you very much.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Welcome back to Hudson Health. My name is Dr. E.J. Akanyeli, Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. So I could have listened to Dr. De La Torre talk forever. I mean, such an insightful surgeon, military person who brings a ton of experience. I think one of the things that struck me is just the acceleration, if you will, in liver disease, even from when I trained as a medical student. And as an emergency physician, totally agree about how indolent, if you will, this is in the society, and we keep seeing more and more liver disease, broken into different types of metabolic liver disease through the alcohol, and of course, hepatitis. Again, I think one of the things that we really, really honed on in this segment is how to prevent cirrhosis. Cirrhosis is the scarring of tissue in the liver. And when that happens, you're sort of on that pathway to perhaps liver cancer, which is preventable. I know the Surgeon General has spoken up against alcohol. There's multiple ways of people reducing alcohol intake, but there's also lifestyle modification, especially because fatty liver or metabolic induced liver disease is becoming a bigger problem. And then hepatitis in all its forms can still be detected at screening. At Jersey City Medical Center, we're very excited to have been one of the first people to start routine hepatitis screening in our emergency department, for example. Having said all this, one thing I do tell people in this show is that we should connect with primary care doctors. One of the things you heard Dr. De La Torre say over and over again is how so much of his work is working with primary care doctors on recognition. Something as simple as a simple blood test as part of your physical could show low platelets, which could be a sign that you do have liver disease. So we encourage people. We have a lot of access. We have a lot of places that are open. And now, finally, should you need surgery, which is sort of the last step, that our entire raison d'etre is to prevent people from getting surgery. But should you need surgery, there are surgeons like Dr. De La Torre. It is becoming more minimally invasive in terms of not having a big scar. Liver surgery is still big for people that get liver cancer. But we have a comprehensive cancer center. We have specialists ready and able to help. The moral of the story is that liver pathology is becoming bigger in the United States. Our goal at RWJ Barnabas Health and Jersey City Medical Center is to keep you, your family, your loved ones healthy, and part of that is getting your screenings, following up with your primary care doctor. Again, thank you for joining me today on Hudson Health. It was a pleasure being here.